variables to take into account. Levels of prevention, when we're talking about infectious disease management and prevention, there's some more extensive explanations of this in your manual. But primary levels of prevention from an epidemiologic sort of public health point of view is preventing new cases of infection from occurring. How do you do that? We just talked about a couple. What are some ways of preventing new cases of disease? Vaccination, right? Okay. What else? Health promotion. Excellent. Health promotion. Okay. Health promotion, preventing exposure to the source of the pathogen, okay, the reservoir host, and prevention of disease like vaccination. Great. Okay. Secondary levels of prevention are detecting new cases really quickly and treating them really quickly. So hopefully they are not passed on to other individuals. So what are some ways that you do that? Screening and early diagnosis. Okay, early diagnosis, that goes hand in hand with screening. And another word for that is surveillance. What's the difference between surveillance and monitoring?
I think there's monitoring is just doing one, and the surveillance with monitoring with again and again with doing something.
Okay, so the suggestion is that monitoring is doing it again and again?
No, monitoring is just we doing once,
and
but
surveillance?
surveillance monitoring tomorrow again and again.
Okay, so one suggestion is it's the frequency. Monitoring is just once, and surveillance is doing it over and over. Any other different?
My opinion is that surveillance is being done when we are going to detect new cases. Meanwhile, monitoring is a step we take after we have given medication to make sure that our medication is working on that person.
Okay, that's an excellent point, that's a kind of a clinical definition of monitoring. So you're monitoring the patient. You're monitoring the health of the patient. Maybe you're monitoring compliance. You're monitoring progression of disease. The terminology is a little bit different in clinical medicine, right? So we have all the different monitoring equipment in clinical medicine. In public health, the difference between surveillance and monitoring, and again, it's vocabulary, it's kind of jargon, but it's important to recognize surveillance activities they can be the same. They can be the same types of testing, the same types of asking for information and data, screening tests. The difference in epidemiology is that surveillance is going to trigger an action. Monitoring may just be collecting data. Okay, you're collecting data on prevalence of malaria or incidence of malaria in a particular hospital. And here's your case level, it goes up, you're just monitoring. Okay, surveillance is tied to an action, some sort of response from public health or veterinary public health. If you're monitoring incidence of malaria in a district hospital and you see the incidence begin to rise, you're going to do something. Okay, so surveillance is tied to a response action. Does that make sense? Yes, okay. Thank you for answering, yes. And then tertiary levels of prevention, okay? Preventing the worst outcomes of disease in an individual and sort of by extension a population. So these tertiary levels of prevention, it's a bit of cognitive dissonance saying tertiary prevention, because you're not really preventing the disease, but you're preventing the worst impacts, okay? And so preventing the worst impacts deals with early treatment and then rehabilitation. And a lot of this depends upon what is the specific disease you're talking about. Is it something like cancer? Is it traumatic disease? Is it chronic disease such as diabetes, high blood pressure? But rehabilitation, a lot of people stop with physical rehabilitation. They think about physical rehab, say after you break a leg, right? And you need to spend time not putting weight on that leg. And so then once you can put weight on it again, you have to learn how to walk. You need some physical rehab. Rehabilitation can also mean psychological rehabilitation. It can mean financial rehabilitation, social rehabilitation. So all of these components of rehabilitation are part of preventing the worst outcomes for an individual and by extension for populations or communities as well. So we spoke a little bit already about the chain of infection and what that means and why it's important. It's important from a public health and veterinary public health standpoint that you remember those parts of the chain of infection, because you can intervene in all of those different steps to break the chain of infection, okay? And I'm not going to belabor this point too much before lunch, and again, because you can't see it so well, but it's a very detailed graphic when you get your copies. Are they going to be electronic copies? I think they're going to be electronic copies that they'll get. Not PDFs, okay. I'll try to include the website link so that you can look at these, because these have very good information about how to break the chain of infection. So thinking about infectious agent, minimizing exposure or blocking exposure with things like mosquito nets, okay? There are lots of different interventions at each step in that chain in ways that, from an infectious disease management point of view, you can break that chain of infection. And so those are things you're going to dig into a little bit more in your groups when you start tackling, developing your own management plan for your assigned disease. And I mentioned this already a bit about public health surveillance, you know, what it is. It's continuous systematic collection, analysis, interpretation of data related to health that you need for planning, for implementation, so responding to disease outbreaks, and for evaluation of how good a job you're doing at protecting human and animal public health. And by animal, I mean domestic and wild animal too. And surveillance is tied to actions. Okay, some challenges related to infectious disease management, particularly from a One Health perspective, is that pathogens don't know directions, do they? Right? So we spend a lot of time as humans, because we're speciesist, we're concerned about ourselves, and understandably so. We spend a lot of time concerned about what are the pathogens that we can catch from animals, right? Rabies, brucellosis, malaria, Zika. We can name a long list of potential pathogens we can catch from animals. Okay, so we're very concerned about this direction. But pathogens don't know that, and they go back and forth just as easily, okay? And the reason that this is of concern is because every new host encounter is a potential for pathogens to adapt. So somebody already mentioned one of the places that pathogens come from, new pathogens for people, come from mutation, from adaptation. A pathogen that's adapted to another host, say a bat or a rodent or a primate or a pig or a cow or a dog, adapting to live in people. So every time we have an interaction that allows that transmission of a pathogen, that sharing among species, whether it's from animals to humans or humans to animals, we provide a chance for more adaptation. And we have largely ignored, as health professionals, that transmission from humans back to animals, and that's creating problems. It's creating problems for us, it's creating problems for populations of animals, domestic animals and wild animals, including critically endangered wild animals. That's something that I spend a lot of time worrying about and working on. Okay, so I want to give you a couple of examples from some colleagues and some work. So this is some colleagues that work with chimpanzees in the Ivory Coast in West Africa, studying behavior of the chimps, but also quite recently they've started studying the health of the chimpanzees. And they noticed that there were respiratory disease outbreaks happening in the chimpanzees with some regularity, okay? They also noticed that only the groups of chimpanzees that were habituated, that means accustomed to the researchers being there, to human presence, only those groups that were accustomed to and that had this kind of contact, this interaction with humans, were suffering from these respiratory disease outbreaks. So they had teams of veterinarians that were doing necropsies, post-mortem exams, when chimps would die from these respiratory disease outbreaks. And they very quickly found, through histopathology and genetic analysis, that the chimpanzees were suffering from respiratory viruses, metapneumovirus and respiratory syncytial virus. Okay, has anybody heard of those pathogens? Metapneumovirus and respiratory syncytial virus, very common pathogens in people, very high prevalence. There's a seasonality for both of those viruses to be transmitted, okay? And through further deep sequencing and genetic analysis, they found that the strains of those two viral pathogens that were in the chimpanzees causing respiratory epidemics and causing a lot of deaths in those chimpanzees were the same or very closely related to the strains found in the German researchers that were coming to study the chimps in Cote d'Ivoire. So unintended consequences, people that were interested in chimpanzee conservation, that were studying behavior, doing their best, right, were actually introducing novel diseases into these groups of highly endangered chimpanzees. And also, because of our close genetic relationship, evolutionary relationship with great apes, they were providing opportunities for those pathogens to adapt and potentially be transmitted back to people. Okay? And since that initial recognition, there's been recognition that this kind of transmission is happening in many places, in zoos, it's happening in other primate field sites. Okay? In this publication, pandemic human viruses are causing the decline of endangered great apes. That is not a good headline, right? So that reverse zoonosis, the transmission of pathogens from humans back to animals, is having significant impacts on wild populations of endangered animals. Within the last few years, too, how many of you are aware of the outbreak of influenza in swine in Mexico? There was a huge influenza outbreak in swine, pig farms in Mexico, okay? And there's a lot of factory farming, a lot of industrial agriculture in North America, less so in Europe now, but in Latin America as well, in Mexico and Central and South America, and here too, a lot of industrial agriculture, a lot of total confinement swine rearing operations where pigs are born inside, transferred through a series of different barns, enclosures, at different life stages, different growth stages. Okay, they never spend time outside. There's a lot of attention to biosecurity and biosafety, not transmitting known swine diseases between farms. Sometimes the people that are working in these farms have very specific personal protective equipment and biosafety protocols. They have to shower when they come in, they have to shower when they come out, to make sure that there's no diseases being introduced, swine diseases, okay? Following the influenza outbreak in the swine, and analyzing stored samples, researchers found that there were multiple strains of human source influenza that had been circulating in these Mexican swine herds for decades, but nobody had thought to look. Okay, so we know from a lot of experience that influenza moves very, very easily between humans, between a variety of different bird species, chickens and ducks and waterfowl and some wild waterfowl as well, and swine. It's a perfect mixing vessel. But we were so concerned about pathogens coming from other farms to the swine or from swine to people that we forgot to look at what are the people working in these swine farms giving to the pigs. Okay? So multiple different strains of influenza introduced by people into the perfect mixing vessel, creating incredible opportunities for these viruses to adapt and potentially be transmitted to people again. So that's a threat to health.